Alright, the claim I'll be responding to is that the federal government should provide universal health care for all citizens. I will be addressing that the federal government should not provide universal health care and explain why the supposed benefits from a universal health care system will not outweigh these so-called problems. Currently, Americans who are uninsured are still able to receive health care. There are nonprofit organizations along with government-run hospitals which provide services to citizens. Nonprofit organizations include charitable hospitals, which are found throughout many communities in the United States, educational hospitals, research institutions, and public health programs, which are also commonly found within communities. Public health programs offer a wide variety of services to all Americans, including free clinics, immunization clinics, needle exchanges, hospice care for the poor, AIDS prevention programs, and many more. Also, it is illegal for people to be denied emergency treatment, emergency medical services due to a lack of health insurance. Also, universal health care or free health care is not actually free. It will have to be funded through higher taxes from citizens, or all citizens, or there will even be spending cuts in other areas such as defense and education. Those who are healthy and who keep up with regular checkups, either through their private insurances or through free clinics, will have the burden of paying for those who need more frequent medical attention, from those such as smokers who are obese, drink heavily, etc. The preamble of the United States Constitution grants the right. The preamble of the United States Constitution grants the right to life, liberty, and the pursuit of happiness, and to promote the general welfare of the people. I'll come back to that. My opponents make the claim that 62% of bankruptcies in America in 2010 were at least partially related to healthcare costs. However, providing universal healthcare to citizens would create greater government deficits. Like with Medicare and Medicaid, there is greater redistribution of wealth and also greater government spending. Medicare and Medicaid provide nearly 90 million Americans with health insurance a year. 1 in 5 Americans are provided with these services. According to Coburn Senate, a government site, it cost taxpayers about $1 trillion in 2011 to fund these two programs alone. As it stands today, Medicare is nearly $30 trillion in debt. Also, universal health care provides no incentive for the poor to work harder. Free health insurance for all is merely welfare, and the uninsured should not just expect a government handout. For those who are unable to afford insurance, there are programs like Medicare and Medicaid. For those who still cannot afford such programs, there are nonprofit organizations. In every country, there are those citizens who fall between the cracks. Free healthcare is none other than socialized medicine. America does not support socialism, therefore America should not support universal healthcare. There is no need to change our current system. Competition between different insurance companies is more efficient for profits. Free markets are more effective at providing better results and cost controls. In a free market society, less government involvement produces multiple competing organizations which produce lower costs and increased innovation. My partner makes the claim that the current healthcare system does its job, especially in terms of innovation. Under universal healthcare, medical breakthroughs will be held back. An example is as follows. And Andreas, managing director at Stevens Incorporated, said that recently the bill regarding Medicare price mandates was diluted. After such, 36 million new patients of the uninsured have been brought back into the system. Hillary Kramer, Chief Investment Officer of AMG Capital Research, stated some of these 36 million were being treated without any chance of receiving payment or with the chance of minimum reimbursement from Medicaid. After such changes, Pfizer Incorporated, a research-based global pharmaceutical company, which discovers, develops, manufactures, markets, and prescription medicines, recently announced cutbacks in the research and development area. This firm alone will be closing 6 of its 20 research and development sites, and this is only due to wider access to Medicare, a government-run healthcare program that is already in debt. Universal healthcare will be a detriment to America's pharmaceutical and biotechnology industries. Universal healthcare provides no incentive for the poor to work harder. Free health insurance for all is merely welfare, and the uninsured should not just expect a government handout. It is an individual responsibility to work hard, and healthcare is not a shared responsibility. Universal healthcare by nature involves a subsidization of the healthcare costs of the uninsured, an idea that conflicts with the individual responsibility of the freedom of support in America. The preamble of the United States Constitution grants the right to life, liberty, and the pursuit to happiness, and to promote the general welfare of the people. It specifically says promote welfare, not provide. The idea of limiting government was reaffirmed in the 10th Amendment, which says that powers not specifically granted to the federal government belong to the states and the people. Congress does not have the authority to make laws granting universal health care. The power to make decisions regarding health care rests with the states, not the people, not the government. On the other hand, it does grant the American people the pursuit to happiness. If healthcare is government-run and citizens do not have the ability to make the decision as to which insurance company best suits them and their family to take care of them when needed be, where is the happiness in life?